So the first thing I'm going to be doing is I'm going to be performing hand hygiene before I walk into the patient's room. I'm going to gather all of my supplies. I'm going to ensure that there is patient privacy. I'm going to introduce myself. I'm going to say, hi, my name is Taylor and I'm going to be your nurse today. And then I will next be following with the 3 patient identifiers. I'm going to ask the patient to state their first and last name. I'm also going to be confirming their first and last name with their wristband, all while scanning the order for the MAR onto their wristband as well. I'm then going to be asking if the patient has any allergies. And after all of this, I'm going to be checking the name and the order with the MAR again. So after I'm hand sanitized again, next I will be educating the patient on the actual procedure. So today we're going to be performing a central venous catheter, and the surgeon is according to the order and ask if they will be wanting any topical anesthetic. And since I'm itching my face right now, I'm going to go ahead and perform hand hygiene again. And then if the patient does want a topical anesthetic, we'll go ahead and apply that. And if the order calls for it, we'll apply it as well. So to begin the procedure, I'm going to don clean gloves. I'm going to be getting comfortable with the patient, getting the patient comfortable themselves. So I want to make sure that the patient is at my waist, so I'm not bending over on top of the patient or causing any pain to my back. And then I'm going to be exposing the port on the patient. I'm going to be cleaning it with an alcohol swab. And then I'm going to be palpating it while inspecting it. Make sure there's no signs of lesions, bruising, or swelling, or any signs of bleeding. And I'm next going to be observing for any redness, swelling, any discomfort, and the patient's going to deny all of this. I'm then going to be, after I have finished inspecting, I'm going to remove my gloves. And I'm going to dispose of them properly. After removing my gloves, I'm next going to be performing hand hygiene again. And then I'm going to open the outer wrapper of all my supplies, which is going to include the needle of the smallest size. So I'm going to have all my supplies. And then for the sake of room, I'm going to have to do this over here. And I'm grabbing it by the outer edges. And I would be dumping it away from me after I have set down the sterile napkin. And making sure that this isn't touching anything. I'm then going to pour all my supplies. And then I'm going to use this as a trash can. I'm going to perform hand hygiene again. I'm going to be donning my mask. Donning my gown. And next I'm going to be putting on my sterile gloves. So again, for the sake of room, I'm going to scoot this over here out of the way and demonstrate how I would be doing this. So pulling it onto the outer edges. Donning my sterile gloves. And then again, for the sake of room, I'm going to go ahead and remove this out of the way. And so the next thing I'm going to be doing after I have donned my sterile gloves is I'm going to be getting all my supplies ready. So I'm going to grab my sterile tubing, and then I'm going to grab the smallest needle. I'm going to go ahead and get the needle placed. And next, I'm going to be attaching the 10 milliliters of saline solution. And I'm going to be priming it. This is going to be clamped, and I'm going to be priming it. And I'm going to go ahead, and now that this is all ready, I'm going to go ahead and place this onto my sterile field. And I'm going to go ahead and, not breaking my sterile field, I'm going to go ahead and move the patient. This is going to be the patient for today, and this is the skin that I'm going to be using. Next, with my dominant hand, I'm going to go ahead and cleanse the site for at least 30 seconds. And I'm going to be using a chlorhexidine solution. So I'm going to be doing this with not too much pressure, just cleansing the site for at least 30 seconds. And then once I'm done, I'm going to allow this site to air dry. And then while this is air drying, I'm going to go ahead and make sure that the patient is comfortable and make sure that their face is turning away from the procedure, or they're going to have a mask on, and the patient is going to be sitting at a 45-degree angle, and this is going to allow them to avoid embolisms. So with my dominant hand, I'm going to go ahead and get ready to insert. I'm going to grab the needle, and with my non-dominant hand, I'm going to have my saline solution. At a 90-degree angle, I'm going to be inserting the needle into the port, and the 90 degree is going to allow me to ensure the correct placement. So I'm going to go ahead and insert. And to ensure that there is a correct placement, we're going to do a drawback on the syringe. And what this does is we're going to see a drawback of blood, and if we do see a drawback of blood, that's going to confirm that the needle is in the correct spot in the port, and we can go ahead and administer this 10 milliliters of saline solution. So we have to confirm that there's drawback of blood, so we're going to go ahead and administer. The next thing we're going to do is we're going to be covering this site with a clear adhesive patch, and the reason we do this with a clear patch is because we want to make sure we can inspect the site for the next days to come, because we can leave this on for a few days at a time. So I'm going to go ahead and place the clear adhesive patch on top to make sure it stays clean for the next days to come and there's no irritation or any infection risk. So I'm going to place this on top. And the next thing we're going to be doing, we're going to be placing this without a gauze, that way we can see it. So while maintaining a positive pressure, I'm going to go ahead and remove the syringe. This is going to be clamped. I'm going to go ahead and remove this. I'm going to clean up my site. I'm going to be, now since sterile, we do not need everything to be sterile anymore because it is now covered. I'm going to go ahead and label the site with my name and the date. And we use the date because we want to make sure we know when we put this on and when we need to make the next change for this dressing. So, name, date. I'm next going to be removing my mask. I'm next going to be removing my gown. And my mask. And this is all going to take place as I'm kind of walking out of the room. And the last thing I'm going to do is be removing my gloves, placing everything in the correct trash bins. Last thing, I'm going to be performing hand hygiene. And when I finally exit the patient's room, I'm going to go ahead and write down the order. Or I'm going to go ahead and document the patient. So in this video, I'm going to be performing the cleaning and removal of the CVC, central venous catheter. The first thing I'm going to do is I'm going to be reading the doctor's orders. Once I see what the order is, I'm going to go ahead and knock on the patient's room and ask if I can enter. Once the patient confirms that I can enter, I'm going to go ahead and perform hand hygiene right at the door. And I'm going to don clean gloves. And after I've donned clean gloves, I'm going to go ahead and perform my 3 patient identifiers. So the 3 patient identifiers are going to be up to ask the patient for the first and last name. And as I'm asking for their first and last name, I'm going to be confirming it on their wristband. And as I'm doing that, I'm also going to be scanning the order to the wristband and making sure that the order is for the correct patient. So after I have confirmed the order with the patient and the 3 patient identifiers, I'm next going to be explaining the procedure to the patient and asking for consent. Once the patient does give me consent, I will go ahead and begin the procedure. So I have my clean gloves on, so I'm going to begin my assessment. I'm going to first start by looking for any signs of swelling, any bruising, any bleeding. There's no signs of swelling, bruising, or bleeding. I'm next going to move on to palpating, see if there's any tenderness. Patient denies any pain and tenderness. And so after I've done my assessing and my palpating, I'm going to go ahead and get my supplies ready. So I'm going to go ahead and obtain my alcohol swab and my 10 milliliters of saline solution. And the tubing is going to be clamped. And we're going to go ahead and clean the outside of the tubing for at least 30 seconds. Dispose of the alcohol swab and allow this to air dry. I'm next going to be inserting the saline solution, and we're going to go ahead and perform that drawback procedure again. So I'm going to perform drawback, and just to confirm that everything's in the correct site, I am going to be seeing a drawback of blood. And once we've seen that drawback of blood, I'm going to go ahead and administer this 10 milliliters of saline solution. And based on the hospital's policy, if they do require a 10 milliliter flush of heparin, we'll go ahead and perform the same thing. So that's only if the facility does call for it. So after flushing, I'm going to go ahead and clamp the tubing again. I'm going to remove the saline solution, and I'm going to properly dispose of it. And with my non-dominant hand, I'm going to be holding onto the port, and with my dominant hand, I'm going to be removing the adhesive. So I'm going to make sure that there's no pain. We're going to go ahead and remove this, and we're going to go ahead and dispose of it. And again, with my non-dominant hand in a U shape, I'm going to hold the port. That way it stays steady. And I'm going to pull the needle directly straight up with the tubing and just pull it out. And I'm going to go ahead and properly dispose of this as well. And if there is any signs of bleeding, I'll go ahead and stick some gauze on there and just hold some light pressure on top. And once there's no more signs of bleeding, we're going to go ahead and cover this. And I'm going to go ahead and dispose of this. So the next thing I'm going to be doing is disposing of all of my supplies. Everything is thrown away. And I'm going to see if the patient needs anything, make sure that they're comfortable, make sure that their bed is the way that they want it to be, 45-degree angle to avoid any signs of embolisms. And as I'm walking out the door, I'm going to go ahead and now remove my gloves, throw them in the trash, and on the door, I'm going to go ahead and perform hand hygiene. I'm going to exit the patient's room, and then I'm going to document. Thank you.